What are you doing? I feel like I've talked to you today, but I haven't talked to you today because of our conversation.
Good afternoon, and welcome to our information session for special education directors. As you can tell, I have not converted my home office to Cubby. We're actually all in our new space. So here we are, and we're ready to get started. So let me share my screen. You can't
Sarah,
hear
we can't
me?
hear you.
Oh, great. Oh, my goodness.
I can hear you though.
I can hear you.
I
can hear
hear
you.
you too.
Yeah, we can all hear you.
Okay. So let me share my screen then, and sorry, here's I. Okay. Okay. Is that sharing? Is that coming over on your side, anybody?
Yeah, it's sharing,
It is.
Sarah.
Okay, very good. All right. So the three things we are focusing on today, can you hear me now? No? We have,
Yes.
okay, we have Katie Heiss talking to us about some EdPlan SC updates. Then we will ask our I think it'll be Melissa Griffin from SC Partnerships for Inclusion, or Skippy, with some announcements. And then Lisa McClimate will be talking to us about the eligibility criteria. So Katie, go ahead.
All right. Good afternoon. So I just wanted to say that all districts submitted their transition collection successfully. I know Friday was a little stressful watching the numbers roll in and making sure that everybody was able to submit. But I can say that we had a successful transition collection submission. That data is with SCDE and it just got pushed out to PCG and they'll be entering it into EdPlan SC. Another update is that I have added MDR, an additional info document, and additional goal page to the dark transition period forms in EdPlan. So under system transition materials, you'll be able to find those there. And I am working on a transportation one. So just when you think I've got them all, we needed a few more. So those three have been added, and I am working on the transportation form as well. And then the other piece is Enrich is going to read only. They were starting yesterday. So you might go into your site and you're like, hey, I think I can still edit. You might be able to, but that doesn't mean you should be. So on Friday, or before Friday, when you submitted that last collection, that is the data that will be migrated over into EdPlan. So Enrich will be working to go to read only. Like I said, they started yesterday. They said it might take them up to 5 days to get everybody turned over to read only. So don't make any changes in EdPlan, or I'm sorry, in in Enrich. You want to make sure that you're using those transition forms to do any processes from now until we launch on July 8th. When Enrich is read only, you'll be able to view, download, and print. You can run local reports. You cannot submit state collections. The other thing that we learned that you will be able to do is student record transfers. So I had a few districts reach out because they were still getting requests for that. Those record transfers can still be done through Enrich. They will be PDFs. So a finalized IEP will come over just as a PDF. It will not be open like as a program. So it'll be a little bit of a different process than when Enrich was active and not read only. But you'll be able to do that. I'll push out information as I have it, but that's all I have for right now to update you. And we got through the first part, and so now in a couple more weeks, we'll be good. Let's see. And I think there's a question from Chuck. Yes. Do you want me to send out the information about the student record transfer? I think is what Chuck's asking for.
If it's not already on the PCG practice side, is it there?
No, the MDR and the additional info, those are, but I can push out something to the power users with the updates I've shared with you just to make sure everyone's getting the information. I'll do that as
Sure.
well.
Appreciate it.
Yep. If you need anything else, just let me know. As we continue to transition to July 8th, I did have somebody ask if I was confident that July 8th would be the launch date, and I said yes, I am very confident that we will be launching on July 8th. So, all right, thank you.
Thank you, Katie. Melissa?
Sure. Thank you. So we are getting ready to open up our registration. So look for that in July for our annual Early Childhood Inclusion Conference that will be happening in October in Columbia at R2I2. We also have our exhibitor applications open. So those are available to promote resources and things that are available to districts and families without selling. So no sales or vendors, but just information and resources. Can you go to the next slide, please? This is about our syllabus swap for our IHE Inclusion Consortium, which is the higher education group. And so they're going to be doing a syllabus swap for fall courses. And you can kind of get an idea of what other people are doing in their early childhood special education programs. So check it out if you haven't been before. And then we also have, Sarah, will you click for me? Thank you. I know you've probably seen this already, but it's a great resource. So we're sharing this again. And this is our new module for Pyramid Pieces. So you can access that on the Pyramid Pieces website, and Carrie has put the links into the chat. So you can access them there as well. And then continuing, we have our modules for Pyramid, our full modules for Pyramid. Sarah, go ahead and click for me, please. There we go. So that includes 18 hours of training content for birth to 5, trauma-informed care, reducing implicit bias, and there is a certificate of completion included with that. So you'll want to check that out. That's free. Free access to some great information. If you haven't done it, just check it out. And then I'm going to throw in an additional plug here because I know that they extended the registration for SC Teams University in July. And so we have a preschool planning institute that if you haven't signed up for that and you're interested in learning more about how to build your preschool program or strengthen it, please check that out, and you can do that through the SC Teams website. I think that is all for Skippy. Thank you, Sarah.
It is. Thanks, Melissa.
Mine is working, Marietta.
I think we're ready for Lisa.
Thanks, Sarah.
I think we have some folks in OSIS here that are working on their sound situation now that we have new
Listen,
setup.
it's been a crazy start of, getting our technology in place, hooking up cords and wires everywhere. So it's been a crazy kind of day. But we sent an email out that had some dates for training for the criteria and some speech sessions that will be coming out. We had some feedback on the swallowing and feeding session, so we're going to take another look at that. Some questions were that it wasn't in the, covered in the seed and why we're covering it. So we'll take another look at that, and if that's something we need to be addressing or something we don't need to be addressing. But for your purposes as directors, I'm not going to go through every category, but when we do the training, just so you're aware of what we're going to be talking about, because I know it's going to be hard. You can't attend all the trainings. They're going to be the same, so you don't have to attend all 4 over the summer. It's just giving everybody an opportunity to find a time that might be convenient for them. But I got a lot of feedback to just go over some of the basics about initial evals. So, with that being asked, just those reminders that evaluations are conducted within the 60-day timeline, on or before that 60th day. And that's a calendar day. And then after, that's what we collect for indicator 11. I think for a long time, I kind of called some districts to say the eligibility meeting date and the 60-day timeline are not necessarily the same date unless you finish the evaluation in the morning and you held the meeting in the afternoon. Those dates are usually two different dates, and for indicator 11, we collect the 60-day timeline that you've completed that evaluation. And then you have 15 business days, and those are work days, so those don't count weekends to hold the eligibility meeting once you've completed the evaluation. And if you complete that evaluation in 40 days, you have 15 business days from that 40th day to hold that eligibility meeting. So just a reminder on those timelines. And your district, I get a lot of school sites who say, my district does 45 days. Your district can do 60 days to eligibility meeting. Your district can do 45 days. You can be stricter than we are, but you can't be more. You can't say we're going to do 90-day timeline, in other words. And if questions along the way, put them in the if you put them in the chat, that would be awesome. Sarah's going to kind of watch for those from me. And during the process of going and redoing the criteria with the stakeholder group, we got a lot of feedback on, the parent didn't complete a rating scale, and that's in the criteria. And so we did not make the child eligible for whatever the disability category is. And in conducting the evaluation, we all know IDA says you have to use a variety of assessment tools and strategies to gather functional, developmental, academic information about the child, including information provided by the parent. And that we want to make sure that that assists the team in determining, whether the child's eligible and be able to create the content of the child's IEP. Go ahead, Sarah. Let me see what. And it also says not to use any single measure or assessment as the sole criteria for determining whether the child is a child with a disability and for determining an appropriate educational program for the child. And a lot of times you may do lots of measures, you may do observations, you might do assessments, but somebody didn't complete rating scales, and one assessment was why the team chose not to qualify a student because one assessment piece didn't get parent didn't turn in a rating scale, for example. That's still using one single measure of assessment as the sole criteria. It doesn't matter that you might have done interviews, observations, assessments. What this language in IDA means, you cannot use one measure to make that determination alone. All the assessment pieces that are done in a comprehensive eval have to be utilized in making that final decision. And of course, using technically sound instruments. Go ahead, Sarah. So for all disability categories, we're looking at some things that are similar, making sure that the determinant factor for making a determination is not lack of appropriate instruction in reading, including those essential components of reading instruction, lack of appropriate instruction in math, limited English proficiency, and if the child does not otherwise meet the eligibility criteria. And that was something, we talked a lot about in our stakeholder group. We always say the team makes the final decision, but if the child doesn't meet the eligibility criteria, the team cannot say, well, we feel the child's eligible, because it's a team decision. It is a team decision, but regardless of that team decision, if the child doesn't meet the eligibility criteria, The team cannot override that assessment and say that that child is eligible. Okay, Sarah. And for specific learning disability, there's an additional rule out factors. You know, it's not primarily the result of visual, hearing, or motor disability, intellectual disability, emotional disturbance, cultural factors, environmental or economic disadvantage, or limited English proficiency. And as we go, as the state is getting better and better and districts are getting better with the MTSS process, you know, a lot of this can be part of that MTSS process. You have a child referred to MTSS for reading issues. The MTSS team could make sure that child goes for a vision hearing screening by the nurse and rule that out. You need to rule it out for interventions just as you'd need it to rule it out for, you know, evaluations. If a child can't see clearly or hear appropriately, learning will be impacted. Cultural factors, economic or environmental disadvantage, limited English proficiency, some of those can be part of that process. Sarah, keep going. And just, you know, we always kind of say, and I have a tendency to say the SEED, you know, that's the criteria, but the SEED is a guidance document. All the definitions and the criteria within that SEED document are regulation. That part went through the state board, went through the legislation process, was approved, and that part is regulation. All the evaluation portions of each disability category are guidance. So just to kind of make sure we're on the same page as we go through this document. Okay, Sarah. And a lot in most of the categories, you're going to see where it says structured interview instead of just an interview. And a structured interview, not something you have to buy, but it's more predetermined questions to help you gather specific information as an evaluator on, you know, what information do we need about this child? And based on what we're seeing as we're getting that referral process, what's happened through MTSS, what we may need to collect information-wise from parents. So it's just not unstructured where you're having a random hallway conversation and asking the teacher, you know, how's Johnny doing in your class? And there's a million of them online. You want to say structured interview for an evaluation for ADHD, there's tons. So you can create over the years, a lot of school sites, we create our own. This is just one of the ones I created years ago. Just an example, you know, instead of saying, you know, how's Johnny doing in your classroom? You know, how does the student function in the classroom, in large groups, in small groups, during unstructured time, independently, one-on-one? You know, how does the student perform in your class on traditional measures of academic achievement? You know, is the student able to successfully complete academic or developmental tasks? If not, what do they typically finish in relation to other students in your class? So in other words, it's just, you know, how do you get good information and make sure you do? You know, it is a structured interview. And I think the team, you know, wanted to make sure that, you know, the interview process, you know, was a process that gathers really good information for the team to use in making a determination. Okay, Sarah. And these were just a few more example questions for a structured interview. And you can go ahead, Sarah, one more.
Okay.
Or is that?
And that was the end of your slide.
That was it. So I'm going to
Yes.
share.
Yes,
I'm
go
going
right
to share
ahead.
my screen
Okay.
and move my document over. And I'm just going to kind of run through what is significantly different, because a lot of, you know, the SEED is not that different. You know, in 2013, the DSM-5 came out, and Asperger's no longer in the DSM-5, PDD and not otherwise specified, no longer in there. It's all, our language now is autism spectrum disorder, and you're, at the low end or the higher end of the autism spectrum. So that's a big change. We're still looking at some of the same, and I apologize for those who don't like this movement, but we don't say we don't have the same so it's consolidated into just the autism spectrum disorder area, where you're looking at establishing, and I wanted to touch on that. Let me go back a second. But the same thing, persistent deficits in social communication interaction by all of the following. We did add currently are by history we put in because, all the high school psychologists that tend to get maybe a first time autism evaluation because of the child is most likely high functioning. Maybe parents didn't want the evaluation before, and now, high school comes and we're willing to look at autism as a disability. A lot of kids with autism have some of those deficits in, reciprocity. They have a lot of maybe stimming behaviors. They don't have necessarily by high school, but they did when they were younger. So that's the currently are by history. Those repetitive behaviors might not exist if you're getting evaluated in 9th grade, but through that interview process, through that evaluation process, that definitely was something the child did earlier on. So that's that's a little different, the currently or by history. Nothing too different. It's really pulled out, we talked about 2 or 3 observations, but it was very strong, for doing 3 observations. Most of the stakeholder group felt that this is a significant category. It's a significant label we're putting on a child, and we want to make sure that we get it right. Down to, and you can see the difference in the length of autism as it was compared to what it is. We tried to really make things a little more simple, just pretty as straightforward as we could get it. So deaf and hard of hearing, not a lot of big changes to that one. Deaf blind, same, actually very much the same. You'll have to meet the criteria for deaf and hard of hearing and the visual impairment. Developmental delay. There was a lot of conversation on how difficult it was to understand. You could qualify up to the age of 6, you could stay DD through the age of 9, and just the way the language was. And so it really simplified. You can use DD for children from ages 3 through 8. So up until the 9th birthday, if you wanted, I don't think a district would choose to make an 8-year-old DD because you're going to have to reevaluate by the 9th birthday. But to be just simple, that you can use this category from ages 3 through the age of 8. That was a compromise. We kind of we had a lot of directors when we first started out say that through the age of 9 was way too old because kids were not qualifying for any other disability category. And then at that time, the read to succeed 3rd grade issues would come up, and they were holding back a lot of kids because they hadn't been exposed to the curriculum if they were self-contained DD, which, self-contained DD probably shouldn't happen too often. So there was one, half of our group that was through the age of 7. We kind of compromised through the age of 8. Some who wanted to keep it, but through the age of 8 was our compromise. And I think they did a good job of looking at that being appropriate. And same, criteria is very similar, 2 or more standard deviations in one area or 1.5 below the mean in 2 or more areas. We did add and/or a 40% delay in one area or 25% or greater delay in 2 or more areas, because we did train the state on TPBA, transdisciplinary play-based assessments. And that assessment doesn't give you a standard deviation. It gives you a percentage of delay. So since we had offered that to all the districts, and quite a few districts are using TPBA, that was added. So that would make it a little easier. And for all disability categories, you'll see that, we separated the adverse effect and require specialized instruction. And some of the reasoning behind that was, you can get to number 3 and say there is an adverse effect, but that child doesn't necessarily need specialized instruction. They may not need anything. They may need a 504 plan with just accommodations. If you're saying there's an adverse effect, then the next question would be, what is that? How is that adverse effect affecting that child's ability to participate in those age appropriate activities if they're not yet in kindergarten or the general ed curriculum. So we kind of separated that out. There wanted to be more of how a team approaches that. Let's look at the adverse effect and let's see if that requires specialized instruction. So you'll see that quite a bit for everything. And child qualifying under the category of DD cannot qualify for SLI as a secondary disability. Communication is, and I don't know why, speech is used throughout IDEA, and then when they added state's ability to use DD as a category, instead of saying speech, they put communications in there. But communication is the area that's speech under those 5 areas of developmental delay. Before there was, EFA funding was not the 2.6 across the board it is now. It was different for each disability category, and speech brought in, maybe a higher funding. And so having it as a DD and SLI was a little beneficial for districts, but now that EFA funding is all at 2.6, it really doesn't, we can keep DD, and if there's speech issues, it's in that one of those 5 areas under communication. Sarah, any questions? Because I'm talking like a. Let's see. An emotional disability, not a whole lot changed with that. Just maybe cleaned up a little bit. The language just.
Sorry, Lisa, I was
No.
buried in too many tabs here trying to
No,
find
that's
my
okay.
microphone. Yes, one is, can a link to the crosswalk be dropped in the chat? And I'm trying to get into my account to do that. Another is, will current 9-year-olds be grandfathered in for the 24-25 year, or will they all need to be reevaluated prior to the October child count?
I told myself I was not going to forget that, but any child that's already DD is grandfathered in, to the age of 10. We're absolutely not have to go back and reevaluate all those children that have already been evaluated. Those parents were, in those, through that evaluation process, they most likely, if they were listening, they would know that their child was, under that old criteria and was through the age of 9. So, we're not going to change any of that or make districts explain. They're grandfathered in, absolutely.
Good, thank you. And that was the only other
You're
one.
welcome.
I'm looking for that crosswalk to share in the link in the chat.
And intellectual disability, and that's another area where, one reason I came to the South Carolina Department of Ed was to change this criteria. We, in the old criteria, you could qualify with a 70 or lower in verbal reasoning or visual reasoning. The new criteria is a full scale IQ or your general abilities index that's 2 standard deviations below the mean, 70 or below, plus or minus that standard error of measure. A subtest has 2, or a verbal reasoning, visual reasoning, those domains in an IQ test. They only have two subtests that you're taking. And you're making a child, there's 10 to 12, depending on what IQ test you're using, 10 to 12 subtests. And when you are qualifying a child based on 2 of those subtests, the likelihood that child ever, it's just wrong. And we've really gotten so much feedback from the National Association of School Psychs and the DSM has never had in it that you could qualify a child as intellectually disabled based on one domain of an IQ test. It's got to be that full scale IQ. And of course it's going to be, we actually put, and it's just really that adaptive at the beginning. If you don't have, the adaptive functioning has to be 2 standard deviations. You're looking at both low adaptive, low IQ. We see a lot of evaluations where those adaptive scores are not 2 standard deviations below the mean, and that child is intellectually disabled. And when that happens, sometimes you can explain why those adaptive scores are a little high. I've had kids with intellectual disabilities where they come home from school, they're home for hours by themselves. They have a single parent, the environmental conditions they're living in, if they don't learn to do some things well, make a sandwich, do that, they won't eat, they won't, they just get higher adaptive skills, by just by sheer survival instinct. And there's a lot of kids that come, have somebody at home taking care of them that does everything for them and may end up with lower adaptive skills. The team has to explain if those scores aren't lining up, the team has to explain why they feel, that's happening and why they would justify and, making that child intellectually disabled. And this is one where you're looking at that adverse effect. Is there an adverse effect and what's the impact? And this time the impact on those pre-academic cognitive readiness skills, academic performance, classroom behavior, adaptive skills, and vocational skills. So a little bit different than what we've seen before. And basically some of the same, assessments that you're doing. Multiple disabilities basically pretty much stayed the same. Speech was added on there. We got a lot of feedback about orthopedic impairment in speech, and that could happen, and traumatic brain injury in speech, that could happen. But the main, why it's highlighted in black, it's, of course, does not include deaf blindness, but multiple disabilities. This is a child with really significant impairments. This is your ID kids with blindness, intellectual disabilities with orthopedic impairment. These aren't your LB speech kids, you know, these are very significant kids. And then orthopedic impairment, not a whole lot of changes. The change is more in the evaluation components, and these actually lined up a little bit better side by side. You know, you do need that comprehensive written report from that licensed medical provider. For most of the criteria we're looking at, you know, across the board, you're looking at a physician, a physician's assistant, a nurse practitioner. But in the past, we just needed that written report. That was all the evaluation piece had in it. But you're really going, you know, depending on the student, but orthopedic impairment, you're really looking at, you know, fine and gross motor evaluation. So, you know, majority of orthopedic kids, you know, may, depending on need, have those fine and gross motor needs. Any assessment of adaptive skills, and any additional assessments that the team would feel would be necessary, but whether it's achievement, some observations in the classroom, you know, depending on what the team feels, it's not just a report. It's looking at, you know, yes, we have the report, and now what are this child's needs? And it's not just, you know, sitting down and saying these are what we think the needs are. You know, we're actually taking a look at the child in the classroom, seeing how they're doing some evaluations and assessments to be able to get some good information when you go to plan and write that IEP. And other health impairment, very much the same, pretty much, till you get down to the evaluation piece. And, you know, these are the, you know, evaluation pieces don't go through regulation. These are guidance pieces. You know, trying to use the language that the DSM has used for 20 years, you know, what type of ADHD makes a huge difference when you're looking at a child in a manifestation, when you haven't kind of made that clear. What type of ADHD? Are you looking at inattentive type, hyperactive type, combined type? You know, it helps to put that in that evaluation, what type of ADHD, what that looks like for that child, and helps down the road when you do those manifestations, which hopefully you don't have to do for every child. But same health and developmental history, any informal assessments, which has been the same. Observations and you know, anything else. There was one more thing I wanted to say about other health impairments. I'm going to go back. I think for ADHD, and it's somewhere in here, but I'm not going to scroll and make you crazy, but you know, a school psychologist, right here, in case of a child with attention deficit disorder, the diagnosis can be made by a certified school psychologist, and there's been a lot of questions about that. A licensed psychoeducational specialist or a licensed psychologist. You know, outside providers can use the current diagnostic criteria in the most recent version of the DMS or DSM. And school psychologists can use the results of this evaluation to make that diagnosis. So that may be a little bit different than we've seen before. And SLD. Basically, you know, the definition stayed the same. It's a federal definition. The criteria has not, it's mostly cleaned up. It has not changed a lot. It is the criteria pieces that we are required to use in IDEA. You know, we looked a lot at, you know, we had the RTI model which some districts were doing. We looked at where we are with a PSW model, which, you know, right now there are 6, maybe 7 now PSW models, and the research is not good for on any of those models. And so we're looking at, you know, basically what we kind of were looking at before, significantly sub-average academic skills. And there was a lot of push for give us a number, you know, give us, you know, how far behind, you know, and that's something that's very difficult to do, because if you've got a kindergartner going into first grade at the beginning of the year that only knows 10 alphabet letters, kindergarten, you know, they're a year behind. You've got a 5th grader who's working on a 3rd grade level. Which one is more significant? That kindergartner only knowing 10 alphabet letters going into first grade, way more significant than that 5th grader working on a 3rd grade reading level. And so it's not something you can put in a number in. It's something that teams have problem solve for. And, you know, a lot of the letters training is making this helpful. A lot of the new core reading instruction is going to be helpful as, you know, districts move to that new core curriculum and we're getting those, you know, kindergarten up using some good core curriculum will be helpful when we down the road with learning disabilities. Learning experiences. Child's been provided with learning experiences and instruction appropriate for the child's age or state-approved grade level standards in the areas of concern. You know, we've got new ELA standards which follow the science of reading. They're amazing standards. You know, you know, that's going to make this helpful. Has the student been exposed to phonics, phonemic awareness skills? You know, if they have never been exposed, we know that you have to be exposed to those to learn to read. So, you know, that's where we're going to be, you know, well, what kind of intervention can we put in place? Because we won't be able to sort out the disability from, I haven't been instructed appropriately, I haven't been exposed to what I need to be exposed to learn to read. So that's going to be, you know, there's going to be a learning curve there. And, you know, we are going to get our stakeholder group, we'll be getting back together in the fall and putting together an SLD guide that's hopefully going to be able to help walk through this process. But looking at those exclusionary factors, making sure that underachievement is not the result of, you know, limited English, the vision hearing, intellectual disabilities, emotional disabilities, cultural factors, or environmental or economic disadvantage. And any atypical educational history, which is irregular attendance. You know, I've had in my career kindergartner who was in 3 different districts in 1 year. You know, how is that impacting? And a lot of those exclusionary factors, I think I mentioned earlier, are something that can be done and rolled out through the MTSS process. Lack of appropriate evidence-based instruction in writing, in math, and in reading. So making sure that, you know, kids have been exposed to the appropriate instruction. And as the new core curriculum is getting rolled out in districts, that's going to be an easier question to look at down the road. Because the districts have, I believe, 5 core reading curriculum to be choosing from. They're all excellent. They all cover all those essential components of reading. And so I mean, we're cheering it, and you know, as a psychologist, I'm cheering that we have finally gone to something that will make these rollouts something that we can actually talk about in a meeting. A lot of times we just kind of overlook those and move on. And we want to be able to rule those out, that kids were appropriately taught. And then the adverse effect and the impact of that disability. Sarah, any questions so far?
Whoops. Did I just hear you say, for SLD, is there any, whoops, hang on. Did I just hear you say that the stakeholder group is going to make an SLD guide in the fall? Can you expand on this?
Yes. I mean, we're going to pull together and probably a new, stakeholder group because we like to give other folks a chance to participate. We have a new ed associate coming on board on my team who's a school psychologist as well. But we'll be pulling that together once school starts and putting together an SLD guide. At the end of getting that criteria, when we got our final version of the criteria done as a stakeholder group, that was the one thing that I promised the stakeholder group was that this fall, we would pull together another stakeholder group and get a guide out there. Several states have an LD guide, and so they, were able to kind of give me some examples of what they're hoping it would look like. So that will be coming. That is definitely coming.
And there's another question for SLD. Is there any guidance on using PSW or RTI?
We in the evaluation components, we're saying, you have to have a health and developmental history, as it was before. Your educational history for this child, not limited to, but includes classroom performance over the years, what their attendance, any behavioral adjustments to school or behavioral issues in school. What's the discipline history been? Look at state level assessments if, when available, district assessments when available, and, any history of school changes. Like I said, it's not limited to, but you're looking at all these pieces. Then you're looking at instructional history. What's that core instruction been? What intervention history, and this is where you can, pull your RTI data in. As I said, PSW by itself, PSW in general, not, you could look at the research, it's not an effective methodology. It had a lot of new research, and if you want me to send you some, I've got some if you're interested in reading anything. But RTI is not got a lot of strong support when it's used alone and with nothing else to accompany it. So, you're looking at these pieces, instructional history, what intervention history, and is targeted. And the intervention history, it's tough because, we're saying as an evaluator, are targeted interventions appropriate? Were they appropriate for the child? If you've got a kid who can't decode and you had them in reading recovery, that's not aligned to that child's deficits. Reading recovery does not target decoding, and you have to be able to decode before you can read fluently. And so it's looking at that, what interventions are provided, were they aligned to the student's needs? That's the RTI piece. It doesn't have to be in an RTI model. Whatever interventions, it could be that a teacher does tier 2 interventions in her classroom. What did that look like? Were they aligned to that child's specific deficits? And individual student data that you're collecting from any progress monitoring, whether it's through RTI or any other progress monitoring data, any standardized norm referenced achievement test, so any cognitive assessments. So this individual student data, that you're looking at can include any, if you do PSW and you want to, you just can't look at that PSW alone. Does that PSW model, align? Are you also seeing deficits in these other areas that you're looking at? So, we're not saying you can't use it. You can absolutely use it, but you're also looking at all these other pieces. What what's developmental history, health and developmental history telling you? You know, learning disabilities are highly genetic. You know, is there learning disabilities in the family history? Especially dyslexia, very highly hereditary. You know, you've looked at the educational history. Does that align with what you're seeing? And if you're using some PSW information, you know, what was that core instructional history? What's intervention look like for this child? So we're not saying you can't use it. We're just saying, you know, use it with all this other information that you can get on a child. Our office has put out, and hopefully I'm going to get it right, or Angie's going to pop on and correct me, an indicator aligned inventory. And we will, Angie, if you're on and you want to put a link to that in the chat, it is on the Office of Early Learning and Literacy, or Office of Assessment webpage. But we will
Yes,
get it.
I'll put
to
a
you.
link in the chat.
Thank you, Angie. You're saving me. But it is an inventory that just breaks down all the indicators in the reading ELA standards. And it is something, you know, it's a checklist. It should, in our absolutely perfect world, that indicator aligned inventory would be started when that child goes to, gets referred to intervention or an MTSS process. You know, you're looking at what indicators does this child know? What indicators does this child not able to, does not know? You know, that can travel with a child from beginning to, you know, all through the evaluation process to eventually a special ed teacher. It's an amazing tool, and all the instructions and guidance for that are on that web page as well. We just don't have enough in this hour, but we can plan an hour, an LEA session to look through that at some point if everybody is interested. But it's a great tool, and it'll help walk you through the reading part, and then we'll be adding math standards will come out this coming school year. As far as they'll just be rolled out, but then they won't be required until the 25-26 school year. And so we'll just be following up with an indicator aligned inventory for math as soon as those standards get rolled out. Super helpful. I think we were in Aiken at teachers were amazing on their absolute last day of school, let us do some professional development. They're a pilot school for our ESSIP program. And, you know, they thought the indicator aligned inventory was a game changer. So hopefully that's going to be helpful as you walk through the LD process.
Thank you. There is another one, Lisa. How
Sure.
can a district, actually, I think that two people wanted this one. How can a district join the stakeholder group?
Like last time for the stakeholder group, and we'll do the same this time, we sent an email out to all the directors to nominate somebody from their district to participate on the stakeholder team. And we'll do the same again. And that was just so everybody had an opportunity to be involved, and you know, and send us, you know, somebody they wanted to be part of that. And we'll do the same. So.
Okay.
Okay. And Angie, thank you for showing up on your vacation.
Yes, I'm happy to. So there's a few changes just in the speech language impairment part. The definition is pretty much the same. One of the things that you'll see that's different is the speech sound production as opposed to articulation and phonology separately. And the reason for that is just aligning with the current evidence. We also are including some of the things that it does not include. So that is for speech sound impairment and the other ones as well. So speech sound impairment does not include inconsistent errors or situational errors. Somebody went too fast.
I'm sorry.
That's okay. There we go. Uh, also looking closely at the dialect as well as if there's a linguistic difference, meaning they speak another language. And then also making sure that we're relying on current developmental norms. So if you have questions about what the norms are for what sounds should be developed at what age, your speech language pathologist, your lead speech language pathologist, we've talked about this, gosh, for a year or two. So they have that information, but if you would like it directly, I'm happy to send that to you. Go ahead and scroll down. The criteria, what you'll see is a little, it's not a little, it's a lot more clear. And the reason for that is because clear is kind. And so when we have clarity about what that eligibility is, then there should be no questions or less questions about if a child is actually eligible. So you see that very clearly laid out here. Go ahead. Keep going. In terms of language, again, we have those rule out factors. Selective mutism is considered an emotional disability or falls under an anxiety disorder. Again, we have to look at carefully what is the dialect or the influence of the language or learning English. We're not looking at auditory processing as standalone. Keep going. And then isolated language impairments. So if they have only one area of language that's impacted out of 6. So we were trying to make sure that it's a comprehensive deficit in language. Scroll down a little bit more. Now, the big change here, and probably the biggest change of all speech language impairment, is this. We have got to do a better job at looking at if the tool used is technically sound. Now, Lisa mentioned that at the very beginning in terms of we have to use technically sound instruments. She also mentioned that we have to use a variety of assessment tools and strategies. So that is what 1A speaks to specifically, that if we're using a composite score, that we have to make sure that we give consideration for the cut score for that test, because cut scores are not consistent across tests. In other words, presence of a disability could be at 1.5 standard deviations for one test or 2 standard deviations for a different test. So we have to make sure that we're reflecting that test's technical and psychometric properties, as well as the sensitivity and specificity, because that is specific to diagnostic accuracy. And that's what we're looking for, is to make sure we're providing an accurate diagnosis. We're also looking more specifically at a variety of ways to assess other areas of language. So for example, we're looking at phonological awareness. We're looking at narrative abilities, which have a direct correlation to reading comprehension. Go ahead. Same thing for looking at morphology, syntax, relational semantics, and pragmatics, all of which again have a direct impact on a child's ability to comprehend what they read. We're also including dynamic assessment. Dynamic assessment is an evidence-based method of assessment that really helps to rule out whether or not it's a lack of exposure or opportunity, as opposed to a significant or disordered skill. Then of course we have to have that adverse impact. And again, as I've mentioned several times, that language piece is going to be directly connected with adverse educational impact. In terms of fluency, the main thing we're looking at here is to differentiate the difference between stuttering and cluttering. And we'll keep going from there. And again, very clear guidance on what constitutes a fluency disorder, because again, clear is kind. Keep going. And then finally, the same thing for voice. We have the rule out factors, which are, it's not related to dialect or regional language differences. It's not related to indirect things that impact your voice, such as allergies or reflux. Same thing for selective mutism. It's not really related to that. And it's also not related to temporary factors, such as they were screaming a lot at the football game because Clemson won. So we're making sure it's not as due to that. And then scrolling on down, we have some specific tools to help determine that. And as we had before, we have to make sure that we have a physician information to make sure that there's not something structurally wrong with the vocal mechanism, because we cannot observe that in a school. We have to have a physician who can look at the internal structures. And we have to make sure that even if there are internal structural differences, such as vocal nodules, that yes, they are still appropriate or amenable to treatment. And then other than that, you've got where you'll find the evidence. And then the last thing that I was going to talk about that Lisa had mentioned that there were questions about is feeding and swallowing. So feeding and swallowing is not a standalone diagnosis. Typically, a child who has a feeding and swallowing disorder is going to be a child who has some significant difficulties or medical impairments. So it's not a standalone. Typically, this child will fall under OHI, other health impairment. Now, if there's a question about feeding and swallowing, as per usual, anytime there's a question, the team has to first meet to gather more information. So from there, it takes a very specialized skill set in order to address feeding and swallowing. So as I've been talking about with the lead SLPs, what this really means is you've got to have those personnel with that specific expertise. So districts may want to look at, as have several already done, creating a feeding and swallowing team, because feeding and swallowing is not a standalone issue. Usually it also involves looking at fine motor skills, which would involve the OT, positioning, which would involve the PT, and then of course, without a doubt, it would have to include nursing. So again, when and if you have additional questions about feeding and swallowing, please know that there will be a recorded PowerPoint about that coming up very soon.
Thanks, Angie. So we're running out of time, or we're 2 minutes over, so I'm going to try to get through these last ones real quick. Traumatic brain injury, we did pull together the Brain Injury Association of South Carolina when we worked on this category. The definition is right from the Brain Injury Association of the United States group. And so the criteria used to be evidence that the child had a traumatic brain injury. And most districts required a doctor to say, this child has had a traumatic brain injury. So, you know, that's changed to the child must have an acquired injury to the brain that occurred following a period of normal development. And it doesn't necessarily have to say traumatic brain injury. It could be that the acquired injury was, you know, an open head injury, and that's what the diagnosis said. It could be that the child's had 3 concussions. Those are brain injuries, you know. So it doesn't have to be a medical diagnosis that says specifically this child has a traumatic brain injury. This child has had multiple concussions. That's going to be okay to look at that. Child's had an open head injury. So we're very much defining brain injury. And definitely aligning with the Brain Injury Association. But an open head injury, they've had a closed head injury, deceleration injuries, you know, this is shaken baby syndrome, any chemical or toxic reasons, lead poisoning, and that type of thing. Hypoxia, lack of oxygen, tumors, infections, so stroke. So we're kind of just doing hopefully a better job of explaining the type of brain injuries. So, you know, if a child doesn't have a diagnosis of a traumatic brain injury, but they have a diagnosis that they've had a stroke, and the team is seeing some significant, you know, changes in their learning and functioning, that would be all you would need. And the rest of the evaluation as well. But, you know, for that diagnosis piece, you know, just the diagnosis for one of those categories. And then that adverse effect. And that adverse effect we can see in lots of different places for our kids with some traumatic brain injuries. And it kind of just goes through, you know, what some of those can look like. And then the adverse effect and the impact of that. So that evaluation piece, you know, you've got that medical diagnosis, parent guardian interview, your educational history, you know, if needed, maybe a speech language eval, if needed, fine and gross motor, and any additional assessments that the team would feel that were relevant, depending on the student's brain injury. And then visual impairment is basically stayed the same, except for other visual impairment, not perceptual in nature, resulting from a medically documented condition. We did get a letter from OSIP saying that our vision criteria did not meet their standards, because we really had to be, we couldn't put parameters on it with the vision requirements above, that we had to say any visual impairment, not perceptual in nature, that would have an impact. So we kind of, that's the piece that we've added that's different. And everything else is pretty much the same. And for me, Sarah, whoops. For me, Sarah, that's it. Any other questions?
Whoops,
And
I
when
was-
we do the training sessions, there are 3 hours on there. We'll go through that a little more as far as, you know, what some of those evaluation components look like when you're doing the evaluation. So more based on, you know, for school psychs and what you see when you're evaluating, what those evaluations look like. So we'll get a little more detail for that as we go through.
Lisa, there is another question in the chat. Will the State Department be providing worksheets for eligibility? And if so, when would we expect to receive those?
And Katie, you can tell me if I'm wrong, but those were going to be added to Ed Plan's resources.
They're in there already.
They're in there already.
I will
Perfect.
double check that they didn't somehow get deleted. But
And I'm
they
glad you
should be in
said
there.
that, yeah, Tabitha, because what we put in there, it's just very basic. It's basically a checkbox that this child met the criteria, checkbox for the evaluation components. And, you know, that was intentional for some feedback from the stakeholder group is, you know, eligibility worksheets are not required under IDEA. And so you can take those worksheets that are in resources and you can, you know, put your logo on the top, but your school psychs, your team, you can sit down and you can make your worksheets workable for your district, if that makes any sense. So we're not saying you have to use them. We just tried to make them very basic. And then, you know, you can tweak them any way you want and put them in your district resources that your district can access, and make them in any format that you guys want to do. Give you some flexibility, hopefully.
Okay, and so a follow-up, so nothing more detailed will be provided by the State Department. Would you be willing to review ours if we create some?
Sure, absolutely.
Okay. Great, I am
And
trying.
I double checked, they are under the special education
Okay.
forms tab.
And
They're
they're-
PDFs, they're just regular PDFs.
Yeah.
But I have talked to Lisa and Sherry about making those fillable now that, you
Yeah.
know, I like making fillable forms apparently, so I can make those fillable too.
Yeah.
And then that would be an option for districts. They
Yeah.
have them that way as well as just a regular PDF.
And I think overall in our, you know, a lot of school psychs, you know, that the worksheet that's in there is what a lot of us will, in the old days, I guess we printed it out, I put it inside a folder. And for every evaluation I completed, I checked that, hey, I've done this piece, I've done this piece, you know, and we go into those meetings and, you know, we're looking at the criteria, you know, and we're just checking off they meet this, they don't meet this, you know, what they do meet and don't meet. Simplistic, but it's always been, you know, really helpful and to be simple like that. You know, and another, just to add another piece, you know, when we do the training for the school psychs, you know, we are going to say that, you know, you can say as a school psychologist, it is the opinion of the school psychologist that this child meets all the criteria for eligibility, you know, for this disability category. You know, you're not qualifying the student, you're just saying you did the evaluation, you've got all the information. Does this child meet the eligibility criteria or not? You absolutely can use the word dyslexia, you know, dysgraphia, dyscalculia. That came in the 2015 memo, I believe, that you can use those terms, and don't be afraid to use those terms, in other words. And anything else I can think of at this moment? Nothing. But we're all sore from moving boxes and crawling under desks and trying to wire our equipment. So
They
if
are
you think,
based
you
on
think-
the new, and they said double
yes,
checking.
yes.
Okay.
And so if you think of anything you didn't get to ask, you know, don't hesitate. Just drop me an email. Be happy to answer those questions.
Great. Thank you so much, Lisa.
Sure,
And
thank
Angie.
you.
I just I think it was Melissa Griffin from Skippy mentioned that they've extended the time for the registration for Summer University. So I slipped an extra slide in here, and Carrie Cannengeiser put it in the chat that they are extending it until this Friday. So if you and your team have not yet had a chance to register, you have a few extra days. And then the last thing I was going to say, where's my little arrow, is we looked at our schedule for July, and the week of our next one would be July 2nd, but that's the week of the holiday. We figure a lot of people might not be here. And then the one after that falls during Summer University. We thought that might not be a good one. So Peter chose July 9th as our next information session, and that lands obviously the day after we have the when Ed Plan reopens. So we thought that might be a good day to have a meeting. So we will see you again. I will do cancellations for the 2 July meetings that we already have on your calendars that I already sent out invitations for, and I will send a new one for the July 9th. And then in August, we'll get back to our usual first and third Tuesdays of the month. And it looks like we have one more thing in our chat. Can you link the registration for Summer University? Yes, ma'am, we can do that. Oh, a couple people asking. And July 9th is SRT webinar for Ed Plan at 3 p.m. Oh, Wendy, thank you for letting us know that. I'll talk to Peter. We'll get a date out to you all. So Peter,
yeah, we can just change the time. I mean, I think part of the reason why we put it at this time is during the school year. We try to get it later in the afternoon so it doesn't interfere with school time. So with the SRT webinar, we'll just schedule around that, but we can keep it on the 9th, but that way you guys can have double webinars that day, but we'll just put it on another time slot, maybe 2 to 3. So we'll look at that. I did want to point out that, that feature in, the ability to do student transfers in Enrich while it's read-only, could be a good thing for districts. I know as students transfer this summer that the receiving district would obviously want to get started on planning potentially for the services for the student and get the information. So that allows you to transfer the files. Once again, you wouldn't be transferring any live data, any program, so that program could be created as a comparable services statement in your own Enrich system. That feature is not available, but what is available is the ability to transfer documents with your fellow districts. So that's good that feature keeps going. So I just wanted to reiterate that because somebody asked if you should be doing it. You're not really transferring that student through the system in the same way when Enrich was active, but it does allow you to to securely transmit records is what we understand. Basically, the files that are enriched to the new district who would have that student. So that's what it should be used for. I did notice on the worksheets, I was just going to say, certainly, documenting the reasons or the decisions on eligibility are good things to do. Sometimes I know that completing those worksheets when you get a case that might go into litigation, they have been useful because oftentimes some number of months have passed before that comes up in a due process hearing or otherwise. And so it's good to have that evidence and that more detailed checklist of things to help staff remember what went on because they do a lot of different evaluations. So it is a useful tool. And we did update those worksheets with the new criteria. So thank you very much for all you do. I also dropped in our new address in case you have meetings or something comes up and you're like, where is the State Department of Education now? You would definitely not want to go to Laurel Street anymore because you won't find any of us there. You have to find us out at the State Farmers Market. So I did put in the current address, although they're looking to possibly change it in the future. But that, for the time being, is our address at 428 Wholesale Lane, next to all the warehouses that have produce from the various vendors. So if you do come out here, it gives you a chance to buy some fresh produce. Thank you for everything you do, and we'll see you in July.
Very good. Thank you.
Thank you.